Bismillahirrahmanirrahim. Assalamu alaikum. Today's our topic is how to measure fetal heart rate and rhythm. Rhythm disturbances can be seen in 1 to 2% in all pregnancies. 6 to 15% may have structural cardiac lesion or persistent arrhythmias may lead to high drops, neurological damages, mortality rate increase in newborn. Normal heart rate occurs about 140 plus minus 20 beat per minute at 20 weeks and 130 plus minus 20 beat per minute at term. Abnormal rhythm is said when sustained tachycardia 180 more than 180 beat per minute more than 10 seconds, or the tachycardia is labeled when mother is in labor and the baby heart rate goes up. You have to measure the mother's temperature and you should think about the in, uh, infection like chorea. Number two is the sustained bradycardia when the heart rate is less than 120 beat per minute in more than 10 seconds. When bradycardia is caused due to the poor oxygen supply to the baby and mother is having high blood pressure and she is smoker, or she may be overdue, or the placenta staying calcified. Number third is the frequent irregular beat when there is more than 1 in 10 beats irregular. It is said to be frequent irregular beat. Now the diagnostic method, we have 2D mode, M mode, color Doppler and PW. 2D mode is the quantitative assessment of the rhythm, like atrial assessment in case of the atrial flutter. And second one is the M mode, which shows or help to assess the coordination between the atria and ventricle movement. But sometimes we become unable to assess it due to the image limitation in fetal echocardiography, or the position of the heart in the fetus. Number third or fourth are the color and pulse wave Doppler. We can use these uh, modes, color and pulse wave Doppler, in LV inflow and outflow through the five chamber view, and in aorta and SVC we can assess, we can put the color and pulse wave Doppler through the triple vessel view, or we can also have a Doppler on the through PFO and the hepatic veins in order to assess the atrial activity. So the atria and ventricular coordination can be seen by all these mentioned uh, diagnostic methods which I explained here. Now, the next one is the new technique. Here we have the fetal magnetocardiography and the electrocardiography, which help to measure the interval between the P and T waves. And there is also myocardial deformation imaging, which is still evolving, not yet available in our country. Now, let's move to the practical approach. Now move toward the practical approach, how to measure the fetal rhythm and fetal heart rate. We have a four-chamber view and put the M mode across the atria or the ventricle. We can have the coordination. We can have the atrioventricular coordination here. This shows the rhythm is normal. Atria, ventricle, ventricle, atria. So after having the after seeing the coordination between the atria and the ventricle, we move toward measuring the heart rate. For this we press the measure button and get the heart rate option on the screen. We select it and then come back to the previous image in order to measure it. Some machines have two beat cycle and some have one. I have setting of 2 beats. Now we can have the heart rate of this patient. Gestational age is 8 months. Now 135 beat per minute we get it. This is the second mode of measuring fetal heart rate. We can measure it by putting the color Doppler over here and then M mode across the atrioventricle. You can see the flow across atrioventricle. On color Doppler, it's normal and show the normal fetal heart rate as well as. These are some pictures of fetal heart rate on color Doppler. Third mode, which is PW mode, we put it across the RVOT, and then we select the freeze button on the keyboard. Freeze button on the keyboard, it had ultimately selected the heart rate from the machine, and it is shown on the left side of the screen, 125 beats per minute. This is all about how to measure the fetal heart rate.